Hi, I'm Dr. Ken Doleski, and
And I'm Dr. Marion Wolford.
we've been together for 25 years practicing orthodontics. And to prepare us to be orthodontists, my schooling was after high school, I went to Allegheny College for 4 years to get a Bachelor in Science degree. It was in biology. And then from Allegheny College, I moved on to the University of Pittsburgh to get my dental degree. At that point, I was a dentist doing fillings. And then for the orthodontic residency part of my career, I went to the University of Iowa for 2 years. And Dr. Wolford,
Yes, I attended the University of Pittsburgh for my undergraduate studies with a degree in nursing. And then I also attended the University of Pittsburgh for dental school. When I finished dental school, I had a really strong interest in treating children, so I went on to specialize at Children's Hospital of Pittsburgh and earned a degree in pediatric dentistry. And finally, I finished my studies at the University of Detroit Mercy with a specialty degree in orthodontics. So today, Dr. Doleski and I are here to share our thoughts with you on a career in orthodontics.
hi. An orthodontist is a career that lasts a lifetime. You'll be part of a very diverse group of people from all walks of life. And what is an orthodontist? An orthodontist is a specialist in the diagnosis and prevention of facial and dental irregularities. What does that mean? It means you can take a bite that looks like this and turn it into this, or we can take a bite with a snaggle tooth like that canine and turn it into a nice smile like this, or take an underbite and turn it into a proper bite. To get a good bite, you need to take the top teeth and mesh them with the bottom teeth, almost like the gears of a clock would meet together. This gives you really good function. It gives you nice biting abilities, nice chewing abilities. Some people have front teeth that actually don't touch, so they have to bite or chew from the side of their mouth. This just gives a nice even chewing surface that isn't painful. And some people can even speak better if you have a large gap between your teeth, or if the teeth are far apart. S's and a few sounds can be a little hard to say. Also, at the same time, once the bite's together, you get that really beautiful smile that's big, that says, I have a nice, healthy smile. To become an orthodontist, there's a lot of school that happens after high school. From high school, you would go into college for 4 years. I got a master's, or actually a biology degree, and then a master's in anatomy after that. And then in dental school, I went to the University of Pittsburgh for 4 years, and I'm a general dentist at that point. You can do fillings. And then orthodontic residency is typically 2 years after that. And I went to the University of Iowa for my 2 years there. So, how do you create healthy, beautiful smiles? Well, it really starts with someone coming into the office, sitting down, and just taking a look and talking with them. We'll take a look and say, how are you doing with your smile? Do you have any concerns? Take a look at the teeth and how they bite, um, and just see how everything's lining up in general. And then we correct or collect information. It could be plaster models, like you see here. With the technology today, a lot more interesting things are 3D scans of the teeth, where you can just rotate the teeth from a scan that you get of the mouth. We take x-rays like this panoramic x-ray. Let's just see how healthy the teeth are. Let's just see what's happening under the gums. And this is also the x-ray that you would use to decide, do we want to keep our third molars and wisdom teeth or take them out? And there's also one last x-ray that comes from the side of the head. Now let's just really see the angles of the teeth, how the soft tissue is coming together, how does the top jaw relate to the bottom jaw. So this gives us a lot of good information to make accurate decisions. And then you take all those informational pieces, put them together. Maybe like in the case you see here, the one tooth is fractured and needs to be fixed by the dentist before we can get going. And then we get into treatment. So how are we going to fix these teeth? One of the main ways and most popular still are appliances like braces. Braces are just little squares. They can be metal, they can be clear, that bond or glue onto the front of each tooth with wires that go from tooth to tooth, brace to brace, that kind of push and pull and line up the teeth. And you might have seen people with rubber bands, so they hook on. They help pull the top and bottom teeth together to get that nice bite that we talked about. Another popular appliance is clear aligners like Invisalign. There's a lot of new ones on the market these days. Um, Usually you wear them full time, and then every week you switch to the next aligner. And these are all made from that 3D scan that I had talked about. That gets sent off to the aligner company. We all move the teeth and then bring us back a whole series of aligners to use. Younger kids sometimes will get expanders, which goes on the roof of the mouth. And it's basically a little key and screw system that really, really slowly widen the roof of the mouth and the teeth. And it really helps with the bite and with getting more room for the teeth that are trying to come in. And then after the teeth are where we want them, they look very healthy, have a great smile. Off to Hollywood, the next thing you want to do is hold the teeth. So it could be a upper left, could be a nice plastic retainer with wires to really help hold the teeth where they are, especially in younger kids. It could be clear aligners that look like Invisalign that snap over the teeth, or it could be a bonded retainer that just goes on the back of the teeth and just kind of locks the teeth in position. Some other nice technology that's just coming into orthodontics now where the retainers after braces can be made with 3D printing. It can be done in the office. You can send them off to companies that 3D print them. So technology really has changed how orthodontics is working these days. So for my day, what do we do all day at the office? Start by getting there a little bit early, going over the whole schedule today with everyone for the day with everyone in the office. We'll go over anybody with any medical conditions we need to think about. Do we have all of retainers and appliances on hand that we need for the patient? And just try to get a leg up on the day a little bit to make sure it runs smoothly. Then you start seeing patients. It could be going over toothbrushing. It could be, just taking off the little colors and putting them on because there's all kinds of fun colors. Um, Hooking up rubber bands, tightening up the braces a little bit. Sometimes we'll just sit down and go over, hey, you've been a good toothbrusher, keep it up, or hey, you haven't been a good toothbrusher, you really need to step it up and then explain how to do that. Or go over some x-rays and radiographs, make sure everything is going smoothly for those patients already in the middle of treatment and make sure they're on course to do that. So some of the days can be pretty fast moving for that. Um, Other things that help me decide what we're going to do for a diagnosis or for the day is drawings like you see here. This is a diagram of that one x-ray that came from the side of the head. And this is really kind of a nice uh, thought of when you're taking geometry and math, you think I'm never going to use that again. Well, this is a place where it kind of comes in on a small um, place. You have the angles, you have the geometry. It helps us see how the teeth are lining up. Sees the angles of the top jaw to the bottom jaw. Really just gives us a lot of information on how we want to treat whatever bite problem that we have. Um, and then after office, what do we do at the end of the day? Usually stay a little bit later. We'll continue working up, all the information that we collected for the day, getting some treatment plans. If we need to call a dentist, like to fix a tooth or we see a cavity, we're really working side by side with the dentist. Sometimes they're going to put an implant or a cap on there. And then what the orthodontist will do is make the space the right size so the cap and everything fits properly. And we need to work closely with the dentist for that. And then you just do a lot of small business things that all small businesses have, whether you're an orthodontic office or not. And that would be pay the bills, gas, electric, water, decide who's going to clear the snow in the parking lot for the year, fix a broken air conditioner if you have one, make sure that payroll is met for all the employees. So there's a lot of time before, during, actually, and after work that we do a lot of that kind of chores. And then there's continuing education. To be licensed, you need to have continuing education classes every year to stay on top of the current treatments. Usually you would go to a lot of seminars and a lot of the meetings and conventions. With the pandemic the last year, most of that was online with podcasts and just online lectures. Next, I would like to turn you over to Dr. Wolford so she can talk a little bit about orthodontics and some of the advantages. Thank you.
So that's a typical day for us. and we really enjoy our work. There's many advantages to being an orthodontist. We have the opportunity and privilege of getting to know our patients well. Sometimes we treat many members of the same family so that our relationships go on for a long time. One of the best things about being an orthodontist is watching the change that happens in our patients as they go through orthodontic treatment. It's especially heartening to work with a patient that may have started out as shy or unsure of themselves and then watch them blossom. It can be a real metamorphosis for some patients, whether they're children or adults. Even before treatment is done, patients often begin feeling better about themselves, and we get to be a part of that. Orthodontists literally change people's lives by changing their smiles. An improved smile might be a factor in professional or personal success. A healthy bite definitely contributes to improved dental health, and some would argue that it contributes to one's general health. Orthodontists work with people who are basically healthy, but who have chosen to straighten their misaligned teeth or jaws. We get a great deal of personal and professional satisfaction from being an orthodontist. Another advantage of being an orthodontist is that we can practice almost anywhere, in a big city, a small town, or anything in between. It's a career that lets you choose where you want to live and how you want to live. Orthodontists are in charge of their own careers. About 3 out of 4 orthodontists own their own practices, so we get to be our own boss, and we control our own destiny. There are a lot of options when it comes to employment. As we talked about before, most orthodontists own their own practice, but you don't have to. Some orthodontists practice with 1 or more partners, like Dr. Doleski and I. There are a lot of options when it comes to employment. As we discussed before, most orthodontists own their own practices, but you don't have to. Some orthodontists practice with 1 or more partners, like Dr. Doleski and I, or they may choose to work for another orthodontist. Teaching is another career option. Many instructors also do research while they teach in orthodontics. Orthodontists can also choose a career in the military or working for public health agencies. The future for orthodontics is bright. The demand for services will continue because people will be born with malocclusions, problems with alignment of their teeth and their jaws. They will also acquire them, sometimes through habits like thumb sucking, or because of accidents, or because of the changes that we all encounter as we get older. If you want to become an orthodontist, there are some things you should do now to prepare. Take the hard classes in math and science. It's also a good idea to have classes in business so that you know how to run a business. Take psychology classes so that you understand people. And classes in art help to train your eye in symmetry and balance. It's also important to get some real-world experience by working in an orthodontist's office or in a dental office after school or in the summer. Eye-hand coordination is super important, and make sure it's a skill that is honed. So let's review the education that's required for you to become an orthodontist. It starts with fulfilling your college requirements first. So you should probably start with a major in math or science. The next step is dental school, and that lasts an average of 4 years. And the final step is orthodontic residency. Admission is competitive and selective. About 1 in 15 applicants is accepted. There are 66 accredited orthodontic programs in the United States and about 6 in Canada. It requires 2 to 3 years beyond dental school. Now, as far as specialties go, in addition to orthodontics, if you choose to go a different direction, you can see on the slide that there are several other specialties that are recognized by the American Dental Association. Endodontics, which is root canal therapy, periodontics, which is treating the gums, prosthodontics, which involves crowns, bridges, and implants, pediatric dentists, which is what I initially trained at, and that's treating dental needs of children, a public health dentist, which would be a dental advocate in the community, an oral and maxillofacial pathologist, which is a study of the diseases of the mouth, dental radiology, and finally, oral maxillofacial surgery, which involves surgery of the teeth, mouth, and face. So how can you become an orthodontist? The first thing you want to do is check with the dental schools to learn what qualities they require or what they look for in candidates for their program. You definitely need to have top-notch grades and good people skills. They'll also be looking for people that have good ethical standards. When you're sitting down to think about becoming an orthodontist, one of the things to consider is checking with the dental schools to learn what qualities they require and what they're looking for in the candidates for their program. Another resource is visiting the American Dental Association's website, ada.org, and check out their education career sections on being a dentist, advice, how to apply, and the financial planning. You can also visit the American Student Dental Association's website at asdanet.org. And that will give you a student's perspective on applying to dental school and attending dental school. And finally, if your career choice is really ultimately to be an orthodontist, you may want to look at the American Association of Orthodontists website and focus in on the education section. You can find the accredited orthodontic programs and what is available and what necessary tools you would need in order to apply to orthodontic residency programs. This slide just shows you some of the when you're looking up accredited schools, it will show you the length of treatment, whether it's a combined master's program or just a certificate program, what the length of the program is, what the tuition is, and all of those are great considerations when you're looking into becoming an orthodontist. One of the best things you can do when you become an orthodontist is creating healthy, beautiful smiles. So the last thing is you have to ask yourself, will this career use my skill? Will the career match my abilities? So you look at what your abilities are in the schooling that you take to find out if it's a good match. And one of the most important questions you should ask yourself is, does the career match your personality? Do you enjoy people? And can you see yourself working closely with people? And then finally, a question you should ask yourself is, will it challenge me? Is there enough variation in the profession that will challenge you every day? I love being an orthodontist, and I think it's tremendously rewarding to have the opportunity to transform smiles. I think it's a great career.
Thank you for letting us be part of your career day today. Hopefully it helped in making some decisions for your future career. If you have any questions, please contact us at the office at this email address. Thank you.